Hello, it's John Gonzalez from the Dizziness, Balance and Concussion Centre, and today's blog's about vestibular rehabilitation. Just a quick look at what it is, how it can help people and things like that. So just before we get started, as ever, just a disclaimer that obviously the information in the guide is given with the best intentions, but it's not a substitute for appropriate medical advice or care. Go and see a vestibular therapist if you've got concerns. If you've got any very serious or quick changes in your dizziness, hearing, any sort of signs of stroke and things like that, please go and get acute medical care as well. So obviously we don't accept any liability for the content of the presentation, but equally as always I hope you find it useful and informative as well. So what is vestibular rehabilitation? In essence, it's exercises to stop the dizziness, exercises to keep you balanced, exercises to get you active and living your life again. As simple as that. When we become dizzy, a lot of people think dizziness is a condition. It's not, it's a symptom, and we've got to figure out why you're dizzy, and that's the big thing. And unfortunately there's many causes of dizziness, as we've spoken in different blogs and things. What we're here to try and do is, when somebody is dizzy or they've got that unwanted symptom, why, where, if possible we can find out, and then we start to do some exercises to look at trying to get the brain and the rest of the balance system to compensate, to get people being able to be active as well. Obviously how successful it is will depend on your condition, will depend on the stage of your condition, and will depend on different things, but generally speaking we can get some very good results. So who's it help? There's a list here, but it's certainly not exhaustive at all, but just some of them. Obviously the BPPV, the benign paroxysmal positional vertigo, that's some vestibular rehabilitation. Some of the repositioning maneuvers work very well. Sometimes people need a little bit extra after that, just depending on how long they've had the condition for. Just general hyperfunction, vestibular hyperfunction, unilateral or bilateral. If basically that means that if one of the vestibular systems in one side isn't working as well as it used to, or sometimes it can be both. That can be down to various causes, but equally, in essence, sometimes it doesn't matter why that is the case. What we can do is help improve things when that is in fact presented to us. With Meniere's, we can help with that, but not usually when you're in an acute stage. Equally, it's not going to help with any sort of hearing loss as well, unfortunately. But in terms of balance, dizziness, things like that, thereafter it can help some of the lingering symptoms. Labyrinthitis, neuritis, some of people are coming out of those conditions. Again, if they've been left with some vestibular hyperfunction, that's where we step in and we can work and help. After surgery, we need to kind of get things back in. We've got to get the nervous system and everything firing to be able to compensate with what's been the result of the surgery. So that's a good one to use. And then a lot of people always think, well, I've had this problem for so long, nothing can help me now. No, actually, if you stick to a good vestibular rehabilitation program, it's been tailored to yourself. A lot of people will get the benefits however long they've had the conditions. So it's never a case of, oh no, we give up on it. No, we can carry on. We can try and do different things and get some improvements. How much improvement, what are the gains are, that's anybody's guess, and people respond very differently. But in just purely from experience, some people who've had long standing issues can get some really good, meaningful improvements, which is really nice to see. Obviously, it helps at different stages of conditions as well. Some people, like with the BPPV, you're going to be acute, you're going to have that dizziness there and then, we can help you straight away. Whereas some others, we need to let that acute stage settle down, and then that's the place for vestibular rehabilitation at that time. So it's not always just one size fits all. It's not always at the same time equally. So how do we know what to do? How do we know how to treat it? In essence, it comes down to the assessment. It comes down to a comprehensive assessment to figure out what's wrong. Generally speaking, these assessments, the more time we've got with you, the better quality of answers, the better we can get as a result of a good assessment there. So it's always going to start, like always, with a good history. The more information we can glean from the patients is the better, and that's just by talking to them, asking different questions, trying to figure out what their triggers are, different things like this. A big one there is the patient's goals. We've got to figure out what they want. Is it realistic? Is it not realistic? But also, what is their desire? Because if we can have a goal in mind, generally speaking, people will work towards a goal a lot better and be a lot more compliant with exercise and things as well. With every assessment, we need to rule out more serious pathologies. So we're going to always do a neurological test, trying to make sure that it's nothing's been overlooked, that it is a vestibular issue, rather than something more central. Equally, with more central things, we can obviously work with those, but we need to make sure that they're stable and they've been investigated fully and things like this as well. So that's always going to be part of an assessment there. Lots of times when people come for vestibular rehabilitation, they always wonder why I'm looking at their eyes and seeing what's happening there. Well, that gives us a good idea as to what's happening with the vestibular system. They're very closely linked. They work extremely cleverly and well together. So yeah, the eyes tell us a lot, and there's a lot of different testing where we're going to be seeing what response the eye has or the eyes have and things like this. We can check the semicircular canals, so things for BPPV. This is best done when we've got the goggles on. We've got some goggles that put you into darkness, but equally they record what's happening with your eye there, and that gives us a lot of clues, thankfully. And it takes away any sort of compensation mechanism that people have developed by being able to focus on different things in the room or things like this. It really helps with that. And equally, sometimes it's amazing for people to be able to see what's actually happening with their eye, and then they start to understand truly why they've been feeling so dizzy or the room's been spinning when they can actually see that. So that's always good to be able to use those goggles. We'll look at balance, both just statically and dynamically. Obviously that's very functional. A lot of times people get dizziness, and the knock-on effect is the secondary things. It stops them being active, it stops them walking, it stops them going out shopping, it stops them socialising, things like this. So we want to look at that and what the effect has actually been, and then again we can start to address those problems as well. And then we're going to look at the neck, and we're going to do a musculoskeletal assessment, as we normally would. If people have got issues, say with weakness at their ankles, knee, things like this, or their neck posture's very poor, or muscles have become very tight, maybe as a result of the dizziness and things, we need to have a look at that and make sure we can get on top of that as well. So, what happens after the assessment? Well, in essence, that guides our treatment. So everyone always says, oh, well, what should I do? Well, we need to see what's wrong with you first of all, and then we can tailor something towards yourself. So, as it says, that the treatment is going to be based on what we've found and equally on the goals of the patients and the goals and needs as well, because someone who's a top athlete is going to have a very different set of circumstances, exercises, certainly towards the end, than somebody who's just happy being at home or happy being a desk worker and things like this. It's all going to be tailored to what people want to do and how they want to do it. So different hobbies will be taken into consideration, and desires and things like this, and work and things like this. Some of the common exercises, some habituation exercises, that might provoke some low level dizziness, but it helps then the brain to realise that no, these movements are actually quite normal, and then the brain stops using dizziness as a response. Some coordinated eye and head movements as well to make sure they're kind of getting back up to speed and things like this. Again, retraining different facets of the balance system there. The balance and stability program, that's going to work on various components. It's going to work just on muscles and joints throughout, from the feet all the way up if we're doing it in standing, but it's also going to work on the neck, the spine, and the vestibular spinal reflexes there. It's also going to be working on the eyes as well, so we start to combine a lot of these exercises. Again, it will depend what we need to do for the patient in front of us, and we'll adapt accordingly. The canalith repositioning movements, a lot of people have heard these, doing the Eppleys, the barbecue roll, different things like this. So once we've found out where the problem is, which canal it is, then we'll address it. Thankfully that can be successful quite quickly. Sometimes, depending on how long people have had or been coping with that or living with those symptoms or conditions, they might need a little bit of just other exercises as well just on top, just to get everything back to running as normal, but it's not always the case. And like it says there, specific exercises to suit the patient's goals and needs, and that is really important. It should be tailored to the person rather than just, okay, go away, do this book of exercises. No, we need to make sure it's a lot more personalised than that, really. So, does it work? Is it hard? And will I be able to do it? Well, we've answered some of these already, but does it work is a good one. There is plenty of research out there to show that it has significant benefits on people. It's one of those things that it does work, but it does require perseverance. It's one of those things that as a therapist and things, if I could put my hands on somebody and get them better, great stuff. It's not going to be one of these things. It's going to be a case of, I've got to show you how to do these exercises, what you've got to be looking out for, what you've got to be doing, and then it's a case you've got to go away and do them. And you've got to be quite, not strict, but you've got to be persevering, you've got to be consistent with them, that's the word, to make sure that you are on top of them. Because if you do them once in a blue moon, well, very little's going to change. But equally, that comes into the last point here, is that since the program is tailored to yourself, since it is personalised to yourself, it needs to be pitched at a level that is suited to yourself as well. And the key thing there is that it's a level that you will do. Because I'd much prefer to give somebody 1 or 2 exercises that they will do and they'll do on a consistent basis, and then we can progress those forward, rather than coming out and giving them 10 exercises, say, well, go away and do those. But you look at 10 exercises, you think, I don't have time for that. You don't do them, and then nothing changes. So it needs to be personalised to get the best of, benefits out of it and the best chance of success. And that's really, really important for anyone. And for anyone you go and see, is that we need to make sure that we're doing these things. And therapists can guide you, we can help you in that sense. But unfortunately, a lot of it will come down to yourself with a lot of these exercises and things. But equally, we're there to support you, and if there's too many or things need changing, you let us know, and then we can adapt accordingly. So that's been a brief tour of it all. Further information, obviously, you can go to the Dizziness, Balance and Concussion Centre website at dizziness.therapy.co.uk. I'm always happy to answer questions and things. You can always send me an email at info@dizziness.therapy.co.uk. The Vestibular Disorders Association, excellent. I'm a member here, and it's an excellent resource for patients and professionals alike. www.vestibular.org. It's a great charity, does a lot of great work. So does the Meniere's Society, www.menieres.org.uk. Both of them are great, members of both, and they're excellent resources for everybody to use, professionals and patients alike. Okay, thank you very much for your time. Hope you're well.